Right. Good Wednesday morning, everybody out there in webinar land. We appreciate you joining us for this installation of The Beacon. I'm your host, Kevin Wilson. Thank you for tuning in this morning. This is Dominion Payroll's ongoing webinar series where we bring you insights and perspectives from around the business community to help you navigate today's challenges and rise to meet the opportunities that lay ahead. From legislative updates and analysis to industry spotlights and sharing the stories of folks' entrepreneurial journeys that you may not hear otherwise, The Beacon is here for you every Wednesday at 11 a.m. We do truly appreciate you tuning in and joining us this morning. I'm incredibly excited to tackle this topic today and welcome our panel. Before I introduce them, just a few housekeeping items. If you do have any questions for our guests today, please submit those through the Q&A function at the bottom of your screen. Try to avoid the chat. We record these so that folks can view them later, and the chat does not play nicely with that preservation element. Always, you're welcome to go to dominionpayroll.com and hit the COVID-19 resource button that you see there at the top of your page. That'll take you to our upcoming webinar schedule and a whole host of resources on the CARES Act, FFCRA, and everything that you need to run your business in this day and age. Should you have any burning questions about payroll, recent legislation, or HR issues, always feel free to reach out to questions@dominionpayroll.com, and we will do our best to take care of you. All right, without further ado, it is my great pleasure to introduce our panelists this morning. First up, I'm really excited to have Dr. Mark Rausch, CEO and founder of Secure Health and Wellness, medical practice that is focused on COVID-19 testing and dealing with everything, not just the test, but operational workflows, staffing, training, supply chain issues. Dr. Rausch is also co-founder of BetterMed with locations throughout Virginia and North Carolina, and an ER doctor, avid sportsman. I know that you love mountain biking and skiing, and we're getting into that season. Dr. Rausch, thanks so much for taking the time to be with us this morning.
Absolutely. Very nice to be here today, Kevin. Thank you.
Absolutely. And next up, we have Scott Castro, Director of Health Policy for the Medical Society of Virginia. Background from University of Richmond and American University, and also the Sorensen Institute at UVA. Scott, is advancing policy to improve the lives of the people of Virginia and represents medical practices throughout the state. Scott, I really appreciate you taking the time and being here today.
Yeah, I'm really excited. Looking forward to a fulfilling conversation, Kevin.
Absolutely. Well, guys, let's jump into it. I'd like to give you each an opportunity. I tried to do my best to do a little bio there, but it's always better hearing from the source. Dr. Rausch, if you wouldn't mind, will you tell us a little bit about Secure Health and Wellness and BetterMed and sort of where you guys are sitting, right now, almost 8 months into this pandemic?
Yeah, absolutely, Kevin. So BetterMed Urgent Care was started by, there were 5 founders. We all are ER trained doctors, and in 2012 opened up our first urgent care, kind of feeling like we could deliver a better urgent care experience and really kind of got us out of the hospital, which is kind of as everybody knows, a large administrative burden. And we were trying to get ourselves away from that. And so over this past 8 years now, we've opened up 12 facilities, 8 in Richmond, 2 in Fredericksburg, and then 2 in Charlotte, North Carolina. We really try and deliver a better patient experience. And so the patient is the customer in regards that we want to treat them with empathy and certainly, give them, fantastic quality and really an experience that is also timely. We try and get our patients in and out in 45 minutes is really our goals, because people have lives and they have other things to do. Really, Secure Health kind of came out of BetterMed during the COVID pandemic back in March. And so, Secure Health really saw an opportunity to assist businesses. And so really, we're not dealing with healthcare, health insurance specifically, but we're dealing directly with businesses and trying to assist them getting back to work and keeping their employees safe while at work. And that's really what we've moved towards, and really don't have real much in the way of brick and mortar. We're trying to deliver those services, to the campuses and to the facilities where our clients are.
That's great. I mean, it's certainly a timely business practice, and one that's a clear need, throughout every nook and cranny of the country. Scott, I want to turn to you real quick and tell us a little bit about, first off, what's sort of the mission of the Medical Society of Virginia, and what is your role there?
Yeah, thanks a lot, Kevin. So the Medical Society of Virginia, we represent, we have 10,000 members across the entire Commonwealth, representing physicians and medical students, as well as physician's assistants. We have a very large membership, and what we do here at MSV is we represent the interests of patients as well as our members, both in the Virginia General Assembly as well as just Virginia government overall. And so taking the interests of that very large membership, making sure that those interests are represented within the General Assembly to ensure that we are creating the best environment for physicians here in Virginia to be able to provide care, as well as providing for an environment that is, for Virginia to be the best place for patients to receive care. And so, MSV is actually, we're celebrating our 200th year as an organization. We've been around for a long time, and there are key institutions here in Virginia that have ties back to MSV, including the Board of Health, the Board of Medicine, the Board of the Medical Examiner, and others. And so we're a storied organization that continues to make sure to represent physicians in the halls of power here in Virginia, and to ensure, like I said, that Virginia is the best place to provide and receive care.
That's fantastic. I hadn't realized that you all had that 200-year history. We could do an
This
entire
year
program on just that. The changes over 2 centuries are remarkable. So Mark, I want to turn to you, and as both a practicing doctor but a business operator, there's been some crazy challenges over the last 8 months, and I think that I'd like to go back to February, March, and April, and if you could sort of compare that time period, which I think probably felt like a scramble to everybody. How do we just sort of stand up our operating? How do we change to this? And now that we're sort of in the thick of it, have there been any noteworthy changes in sort of your operating procedure, your day-to-day life? Compare and contrast those time periods for me.
Yeah, I mean, back really was right about March 14th, I think, when the shoe dropped, and we literally, from a BetterMed perspective, our urgent care volumes dropped 80%, and we were looking at not so much what our next steps were in regards to dealing with the pandemic as much as what are we going to do with cash flow, because without patients we're very quickly not going to have a company. And so we saw that there really was a lack of testing happening in Virginia to begin with, even really worse than other states, unfortunately. And we saw ourselves as an opportunity to really kind of step in as a private industry and take and assist with testing. And so we really, at that point, the 5 of us got back into kind of our old ER MacGyver days. And I was calling South Korea and China, and we were, trying to lock up new supply chains of, that didn't exist before. New corporations were and new labs were coming out, and so you're trying to lock up what we thought we needed, right? Which was, gowns, gloves, masks, goggles. I mean, whatever we can get, and really spend a lot of time trying to secure supply chains, and really ones that weren't fraudulent, or imitations, which was really a big problem then. And what we did was just really focused on safely testing our customers, our patients, while protecting our staff. And so we really did some remarkable stuff where we really moved, at that time, we moved the entire testing process outside. We locked the doors at 5 of our facilities and turned them into drive-through testing. So really, there was a huge amount of workflow going in and out of of the facilities, but at the same time, what we really tried to do was work in an open air setting where only one person came in contact with the suspected patient, because we really wanted to protect as well as we could, the other 12 people in the building behind the scenes were doing all this work. And so, that was big for us to deliver a service, and to deliver it safely to protect our employees. We tried really early on to help with the Department of Health. We were doing some free testing for them. We had our staff come out and do some testing at some volunteer events. We tried to get first responders in very quickly, cancer patients, high risk people. And so we had shut down 5 of our facilities, and we're just doing testing at that point. Right. And that really switched. And to be honest with you, urgent care volumes have not necessarily come all the way back. And so, between March and now, BetterMed has become something of a brick and mortar testing company. I mean, we, dealing with insurances and so forth, and we've moved inside because we couldn't exist in the summertime outside. Again, our employees wouldn't be, they couldn't tolerate 100 degrees in full PPE where it's pretty unbearable. So we tried to bring everybody inside, bring them in safely, and then, and then really try and think about how we're going to bring our urgent care volume back, because eventually COVID, is going to kind of roll into a new fold of our, as an endemic probably in a couple of years. And so, we do need to think about our urgent care volumes to run as an operator. So I think that's kind of where we are. We really were all COVID, and just sitting around in the urgent care world. Now we're thinking ourselves, how we're going to get back to that urgent care world while still maintaining COVID until such time it kind of folds into the endemic of influenza and all the other upper respiratory illnesses that it probably will come into, come next year, next flu season. So
sure. Well, I will say that I live around the corner from the BetterMed at Regency Square, and in the early days of this, seeing the testing that was happening was a moment of relief, really, for me. Just knowing that you guys had facilities and that it was accessible in the community. It was just, psychologically, it felt, reassuring to me that it was like,
yeah. And it was great. We had great partners. We had some really great, lab partners that kind of helped us, and we stayed strong with those partners. But and for us, I really was concerned about the employees, and we really had to take a step back and think about how we really truly can protect or just minimize that interaction with the patient so that not everybody had to be exposed. And I think we did that pretty well. And, I think that made me feel better that we took on this massive task, because I think BetterMed at this point has probably tested close to 90,000 people. And Secure Health right now, we've tested over probably 15,000 people since Secure Health started back in June. So it's quite a bit of testing.
Yeah,
quite a lot of testing going on.
Well, that is great. Scott, I'm curious, when you look across the state, we're hearing, here in the urgent care environment, being 80% down, and those numbers aren't rushing back to 100% capacity. With elective procedures and, a lot of these things outside of COVID, I know that I've delayed going to the dentist by 6 months, some things like that. Are you seeing that across your membership?
Yeah, we are. We're hearing that from our members. And also, to be clear, in terms of the volume of, primary care physicians that we have, not just in Virginia, but, in terms of the infrastructure nationwide, those numbers of those providers have been declining even before COVID started. And so COVID has amplified that. A lot of those, smaller 1 to 2 doc practices, it's harder to maintain. It's harder to keep the doors open when so much of that patient volume decreases. We have a lot of our members have been able to adapt, just as Dr. Rausch mentioned. But looking out at the system, of infrastructure of being able to provide PPE. Some of our, a lot of our members who have smaller practices, being able to navigate those supply chains for PPE, for testing, that's outside of their normal scope of what they do, of their business operations. And so, one thing that we heard from our members and that we're working, as part of our priorities as MSB, is looking to better establish, a system within the state to be able to distribute PPE, and so that we don't so docs can, can treat patients instead of having to call companies trying to get gowns. And, that was something that came up in the priorities within our membership, within our own House of Delegates. MSV, we have our members, we have our own little House of Delegates made up of our members, and they meet on an annual basis to kind of decide what policies they want to add to our association's policy compendium, and as well as like what policies, what policy priorities do they want to see MSV be fighting for in the General Assembly in the coming sessions. And this idea of getting a better system to distribute PPE was one of those. But another big thing that I think has helped a lot of our providers, and is something I think we'll see a lot more talk around, is the idea of telemedicine and telehealth. It's still harder for some of the smaller providers to set up the kind of IT infrastructure that you need in order to be able to perform telemedicine and meet all the required regulations in terms of storing those videos, in terms of HIPAA. But the fact that our providers have been able to reimburse for telemedicine services, both audiovisual and audio only, at least during the COVID-19 pandemic, has helped. It's not the saving grace right now, but it's definitely stymied the blow for sure, and it's something that I think we'll be looking towards as a priority, to making sure that post-pandemic this infrastructure doesn't go away, because not only has it been helpful during the pandemic, but this pandemic has kind of highlighted those gaps in service that may exist across the Commonwealth, and those inequities in terms of access to care. And I think by strengthening the network of telemedicine that we have across the Commonwealth, we can have it so that docs can provide care to populations that may not be able to take public transportation to their doctor's office, or might not have broadband to be able to do audiovisual telemedicine, or perhaps older patients who don't have a smartphone, can't do audiovisual telemedicine, that can only do audio only, and making sure that we kind of establish and solidify that kind of infrastructure to be able to not only protect our physicians and make sure that we have enough physicians to be able to provide that access for care across the entire Commonwealth, but to be able to make sure that more patients are able to access it as well.
That's a really fascinating point. I've heard about the access to broadband. It's a perennial topic in the legislature. I've always thought of it really in terms of access to education and entertainment. I hadn't really thought about it from a healthcare perspective. Dr. Rausch, I'm curious if telemedicine has played a role in the way that BetterMed and Secure Health have approached, contacting, or interacting with your patients. Obviously, you can't do a nasal swab or draw blood, through a Zoom call. Mm-hmm. But has that technology impacted the way that you all are able to operate?
Again, I think COVID probably accelerated the success of telemedicine by 5 years, and the way it decelerated or demise of the malls in 5 years, right? Everything accelerated, and I think we're seeing that in healthcare, and so I think there's a role for it, and I think you're right. There really are some places where it doesn't work, and so we never had a telemedicine program at BetterMed, and we started one right about that time, and again, just to try and build an urgent care volume, to get a presence, and it took, as Scott said, quite a bit of work and a lot of bandwidth and a lot of hours and stuff to build it and to build the workflows and so forth around it. So it's not something easy to do, and we're kind of a small corporation, and I can only imagine what it would be like for a primary care doctor to try and do the same thing. But I think the two things that I think about with telemedicine, at least from an urgent care perspective, and the first one you touched on is exactly that. How do you test somebody, right? I mean, how do you test somebody and tell them that they have strep throat when you don't have the strep test?
Right.
And how do you get vital signs on somebody? Really, there's such a limitation in that interaction. And so, we agree to that. And I think there's going to be a way to get through that come the future. But in the short term, BetterMed, we really we uncoupled the telemedicine visit. And so what we've done is that we've had the visit with the patient, had the entire visit, and then actually sent those patients to a brick and mortar site to get tested. And so we're actually able to do a telemedicine visit and still get them tested at one of our facilities. So it works really well in Richmond, as you can imagine, in Fredericksburg and Charlotte. So, that's one thing where I think about in the future that, imagine having something similar to that where, you're going to have a telemedicine visit, and then you're going to go to a strip mall in a small square foot, and there's going to be a medical assistant there only, or maybe a radiation technologist, and you're going to go there just to get blood drawn and to get an x-ray, and then you go home and you finish your care. And so there may be something moving there, and even in secure health, I think of that, right? So imagine doing the same thing in secure health, where we're going to have the pandemic's going to end, and we need to think about employee wellness. And so for me, getting into these businesses, and it's sticky, right? Because it's COVID, and we get in there and we provided a great service. Eventually COVID ends. And so, what can we do? Well, I'm there with a lower paid staff medical assistant. And what they can do for me is they can, do exactly what you said, draw blood, get vital signs, take an x-ray. And this is all happening on site at their facility. Only need a small room to make this happen. And then they have a telemedicine visit with the physician. And so what we're trying to do is fill gaps in care. From a primary care standpoint, to fill that gap in care, and the classic is the hemoglobin A1C, right? I mean, 30% of all people don't get their labs drawn once they go to the doctor. And so there's a fail right there. And so to close that gap with diabetics, that you actually, get their blood drawn at work and have a telecare visit, for a quarterly hemoglobin A1C, the ability to decrease the morbidity that goes along with diabetes is amazing. So I think that's really where I see secure health kind of coming through in the telemedicine side. And again, it's uncoupled, right? You go in, you get your blood drawn, those results come back, then you have a telemedicine visit with somebody, who's not on site, and you're finishing your care. It's just easier on the patient. And I think what you're doing is closing gaps in care, and you're doing some significant cost savings for the employer, so that's kind of the step 2 with secure health once we get through the pandemic. And then the other thing I thought about was really mental health. I think mental health is enormous. I mean, we all know it's at top of mind of everybody, and that we're now going to start seeing reimbursement for mental health issues through telemedicine. You really are gaining so much on an interaction with somebody in a Zoom call. We've all learned that access to a mental health professional via telemedicine, I think it's going to be enormous, and it should be reimbursed, because there is such a difficulty in getting mental health, and it's only going to be getting worse. Even to children like autism. There's a company in town called Answers Now, and they're providing essentially a telemedicine-like service for autistic families. And they're looking to get reimbursed. And so that ability to get somebody into a home right now with COVID is almost impossible, to bring in a board-certified a mental health professional for autism. They call them BCBAs. To get that person now to have a Zoom call and get them into the home via Zoom and talking with the parents and helping, the child is enormous, because there is going to be huge gaps with that in that service line. So I think those are 2 real places that it's happening.
Absolutely. Scott, it looked like you had something you wanted to add there.
You're very astute, Kevin. When it comes to mental health, MSV is also very involved. Not just not just thinking about patients, obviously, and mental health care. MSV, is spinning up and beginning to operate the Virginia, what we call VMAP, Virginia Mental Health Access Project, and that's specifically for children in Virginia. We're seeing, obviously there are shortages of child psychiatrists and child psychologists around the Commonwealth, and referrals from primary care physicians or pediatricians to mental health professionals are creating these long backlogs and gaps in service. And so as part of VMAP, which is sponsored by state funding, and there's new money in this year's budget for that as well. We're trying to spin up essentially call centers for those primary care physicians and those pediatricians to be able to refer their patients to on-call child psychiatrists and child psychologists to be able to receive those services, or at least have a care coordinator connect them with a mental health professional that specializes in children in Virginia who might not have as much of a backlog, and trying to spread that out as much as possible, so we delay those gaps in cover, so we minimize those gaps in coverage, and we shorten the delay for those children to receive mental health services. The other thing we're really concerned about, obviously, as MSV is the mental health of our members, of our physicians, MSV is we are working on our own program called Safe Haven, which I believe on a previous edition of your show, our CEO Melina Davis talked about Safe Haven, which is really a resource for medical students, physicians, and for our members to be able to receive mental health services for themselves and their families without fear of any kind of professional consequence or discipline. As I'm sure Dr. Rausch can attest to, even through medical school, what we're hearing from our members and our med students is kind of this culture of being able to kind of take all this on, all this trauma and all this stress that you see day to day in your practice, and to be able to just kind of carry it. We understand that, we hear from our members that they need to be able to receive these services without having fear that it could jeopardize their professional reputation. And so we have Safe Haven where these providers, these med students can receive, these mental health services without fear of any kind of professional consequence or retribution. That's also receiving state funding as well. And obviously during COVID, those concerns are amplified, that trauma is magnified, and we as an organization are looking out for the mental health of our members as well.
That's absolutely critical, and I love hearing about this sort of reduction of inequity or the democratization of sort of healthcare that these technological solutions can provide, and any time that we see an expansion of access to mental health services, that's absolutely crucial, and I'm encouraged to hear that. I think that's a good sort of transition point to talk about, Dr. Rausch, I want to turn to you and think about, obviously the safety of your staff has been critical. I'm wondering if you could tell us, a little bit about how has BetterMed transitioned, to make sure that your staff is safe and well taken care of. And I'd also, if you could also comment on sort of the state of the supply chain. I know in the early days, it felt like we'd never get toilet paper or masks again. They seem to be in supply again, but is that still a challenge for your facilities?
Yeah, I think that's a great question. I think, from the, Scott said it, very, very well. I mean, we truly are worried about the mental health of our employees as well as our providers. And it has been, we've asked a lot of them. We really have. And we've, you try and help, and give them some relief and tell them it's going to slow down. But I mean, it just, things just keep steamrolling along. And so, there's, from a owner's perspective, I mean, just something as simple as we just started buying lunch every day. I mean, I know it sounds crazy, but one less thing they need to think about, something that they could just not have to worry about. We tried to keep them fed, and we saw that. I think safety was the other big thing. We really brought them in when we decided to bring all those patients in-house, the COVID testing in-house. We really worked with our managers, our site managers, and our clinicians, that how can we do this safely? It's got to happen. we can't be outside forever, and how are we going to do it? So we tried to bring them in and really their boots on the ground, and how, what do you think the workflows are? And I think we've done a pretty good job at each site, really trying again, separate the urgent care person from the COVID person. Essentially, they're going to be the same thing come wintertime, but trying to separate them. And then the second part of it is really limiting the exposure of our employees to those patients. So we're trying to keep people out in the car. We're doing a lot of the conversation again over the phone, like Scott talked about. So it's just a lot of audio in the car to get all the medical information and past medical history and so forth, and really minimize their interaction while in the facility and minimize who they're dealing with while in the facility. And again, to that effect, you still need a supply chain of medical supplies. And I think it's amazing. I think there's enough sanitizer out there now. Like, you see where everything's kind of where things are needed, where they're not needed. And, I think the biggest one that I am seeing, it's gloves. And so I don't think they can make gloves fast enough. And so we've actually been put on allocations at Secure Health for gloves. I'm scrambling to, again, I kind of had a buffer there, but and we built up an inventory. But as of right now, I'm now chasing gloves again. And so paying more, going to different other distributors to just try and find them somewhere. Go to Staples. My wife's practice is a dermatologist. Some of her staff, every day they stop by Publix and try and pick up a set of gloves because she's also on allocation. So that's really the big one. Masks seem to be okay. Gowns seem to be okay. Face shields seem to be okay against plastic, right? I think we saw that kind of ability, but gloves are tough, right? Gloves it's a mold, it's plastic. To build a molding glove machine, to order that machine now, you're going to get it in 2 years. And so how do you ramp up that? How do you ramp that up fast enough? And so, you go from, one shift at a manufacturing facility to 2 shifts. Now what, up to 3 shifts? And so I think, but the amount of gloves that are being used by the public and even in healthcare on top of what was already needed in healthcare, I think that's the big one that really is going to be difficult. I think now all the way through winter and into spring. So that's a concerning one for us.
Yeah, that's an interesting insight, and it's certainly not something that my wife can turn her sewing machine on and crank out a few masks for the neighborhood.
Exactly.
Scott, I'm curious from the perspective of your membership. How are folks out there dealing with a lower volume in terms of people coming in for some of these elective procedures and things like that, and then this additional cost, whether needing to have some of this PPP in place, but also we've seen the cost of some of these things rise over the last several months. Is there something that you're seeing that maybe is happening through the state legislature to try and deal with some of those things, or is it sort of every man for himself out there trying to navigate these challenges?
No, I think there are. I think you have seen the state legislature act in special session, as well as in the last session, getting bills into, as Dr. Rausch and I talked about, being able to kind of accelerate the adaptation of telemedicine and reimburse for it from both a Medicare and Medicaid perspective, but as well as from private insurance providers. That really has been one of the big things that our members have been able to lean on. And like I said, it's something that has helped during the pandemic, but is something that I think we can't take for granted that level of acceleration that we've seen in telemedicine. And I don't think we should slow down in terms of that. It's helping our members treat more patients and treat patient populations that previously may not have been treated, frankly, before. For one of the several reasons I mentioned before, whether it be internet access, access to public transportation, or access to transportation, period. So I think you have seen the state act in terms of that. We will obviously continue to fight to make sure that our members are able to, receive PPE from the state in terms of setting up that infrastructure and making sure that we don't the next time it doesn't have to be every man for himself. As Dr. Rausch alluded, like it kind of has been this time. So much of those administrative operations have had to turn to finding gloves, finding masks, whereas we want our physicians treating patients, especially during a time like this. And so we want to continue to keep that progress moving forward. We don't want to take anything for granted. I don't think anybody, any of our members would tell you that we were effectively prepared for this pandemic, whereas we might have thought before that we were. This pandemic has taught our members a lot. It's taught us a lot as patients, and I think that we can't take that for granted, and we need to keep moving ahead so that we're perhaps over-prepared next time, because we've seen the level of instability that a pandemic can do to the whole system and infrastructure of providing healthcare.
I think I'm going to bungle this phrase, but it was an ounce of prevention's worth a pound of treatment or something. I knew I was going to get that. You guys know where I'm heading with that. And I think
you're good. You're good.
It's funny, Kevin. We saw the same thing. I mean, we did lean on the state at times to help us with supply chain, and they really did their best. I mean, again, the interactions that I had with the Central Virginia coalition, they really kind of came to us, and they were supplying us while we were testing. Because again, we really tested before anybody else, and in March, and I mean, hospitals shut down, middle of March through almost, beginning of May. And so really there wasn't much healthcare going on, but we were really ramping up production, and we were having a hard time. We did reach out to the, Richmond Henrico health departments up in Fredericksburg, and they were able to kind of, as we were grabbing supply chains and trying to grab as much inventory as we could, they were always looking, we could always look to them and get that last mile of supply. And they were really great because it was, like Scott said, it was tough. I mean, and so I can only imagine from, again, the one office physician, how they're going to do that same, who could they reach out to? And I think the state did they did the best they could to try and reach out to those people. And I think once we got into May, I think there was more coordination and so forth. But, I think I found the local health departments were at least, overwhelmed and unprepared. But even of that, I saw them working, 84 hours a week, every day, looking to help the healthcare community. And it was rough on everybody, but, I commend them for doing the best that they could.
For
Absolutely.
sure.
I'd agree with those sentiments as well. And I'm sure our membership would as well.
It's always encouraging when you can see the public and private, sides of the coin come together and work together. I want to sort of shift our focus. We've been sort of looking back at the past 7-8 months and understanding how we got to where we are today. By all, approximation, a successful vaccine is likely to, be available, initially to first responders, physicians, in the next 2 to 3 months. I'm not going to try and pin down a date or which company's coming to market with it, but as you look at sort of the future of BetterMed and operating a healthcare business, what are your 6-month year plans sort of feel like? Are you thinking that far into the future? Are you allowing yourself to think, okay, a vaccine comes along, we get to a place where this is managed in such a way that we can get back to some semblance of normalcy, or are we still taking everything sort of a week or a month at a time?
Yeah, I think we tried to, as a true healthcare operator, I think we are more aggressively looking, forward in just more frequent timeframes. And so, we've gone and looked at where we're headed, every month now instead of every 3 months, let's say. And so we definitely have accelerated that and probably shortened those horizons looking forward. I think there's, I think it's just hard to say. I think it's here to stay. I think this is going to become an endemic. I think I hate to call it the flu because it's just not the right way to phrase it, but a seasonal variant. I think this this hope of a vaccine, I'm a little less hopeful, and I think I'm a little bit more of a realist. I think this is going to envelop and become, like I said, part of the influenza upper respiratory infectious season, probably stronger in winter. Who knows what it looks like in summer? But, for the urgent care perspective, it rolls up into that. And so for you to get back to work again, right? It used to be, even if you had the flu, we give you Tamiflu and you'd stay home for 2 days and you go back to work. Well, I mean, you could still be infectious after 2 days, but that was it. That was the 2 days that we wrote you to get work off, and you went back to work, and you probably infected, half of your colleagues or something. And gosh, from a school system perspective, that was right. The children are the vectors for influenza. And so same thing happened. Missed 2 days, no fever. Mom, filled them full of Tylenol or Motrin, send them off, and they infected the rest of their classroom. I can't imagine how that's going to happen again. I just don't. I think there's just going to be this. And so I think from an urgent care perspective, we become more important, because what we're going to need to be is that front line that's going to say that we're going to have to change the FMLA. I'm going to have to say to somebody, you can't go back to work for 7 days. And, the FMLA is 3 days. And after that, I got to write for FMLA. We never wrote for FMLA. We wrote for 2 days, and that kept us protected from trying to write. I mean, this is HR. We all know how much paperwork FMLA is, and you can't do it. And so something has to change, because your employer is not going to let you come back to work if you've been diagnosed with COVID. They do not want you in the facility if you have anything that remotely looks like a fever, upper respiratory. They're going to want to see how many COVID tests are they going to want to see before they're going to let you back in. And so I think from an urgent care perspective, that's where COVID testing becomes urgent care, an urgent care visit.
Yeah.
And some for secure health and wellness, secure health as well. I think we have this opportunity to be that front line to help protect the company so that their employees feel safe, that we can assist them with contact tracing. I think, the key thing for this to work is it's not shutting down. And I'm not a big fan of shutting down. I understood why we did it. It's the South Korea Taiwanese model. It is testing and contact tracing. I mean, if you could just get these people tested and then very quickly get them out of the population, they're no longer infecting anybody else. And you can control a pandemic. We're not going to say you're going to cure anybody. There's still going to be instances where there's going to be outbreaks, but if you keep the point prevalence low and you aggressively contact trace, you pull them out of the population. We did that at University of Richmond. I'm really proud of University of Richmond. My son goes there, Scott, and went there. I was very happy. I think it was one of my goals was to get my college-age son out of my house because he was driving me crazy. And so we got him. University of Richmond with Secure Health did a phenomenal job of keeping the school open, keeping the infection rate exceedingly low. The students were great. The facilities management people were fantastic. Administration put a huge contact tracing team together. Isolation beds. It cost a lot of money. It took a lot of time, but that's where they put their resources. And for me, I would say that was a success. I mean, we've got them almost all the way to Thanksgiving, and their plan is to go home after Thanksgiving, come back in January, and we're gonna start all over again and do the same thing. But I think that's where I've seen success, and not everybody wants to hear that because testing is expensive. But if we could put our resources towards that, and I mean, as important as contact tracing, because you've got to get those people out of the population.
For sure.
And that is really where this is. And I think we would control it much better if we can get our prevalence down. I think that's where South Korea and Taiwan had done so well and continue to do well, to be honest with you.
Yeah. Well, kudos to you with University of Richmond. Guilty of sort of doom scrolling a little bit through different VDH charts and graphs and things like that. But in comparison, a JMU versus a U of R are just really different stories.
And it is. And JMU's, 22,000 people. I mean, that's a whole different animal, right? I mean, University of Richmond is a little bit smaller, better, a contained campus like JMU's, but imagine VCU, what they had to do, right? On a massive city campus, but again, probably resource wise, I think I think it can happen if I think the appropriate resources are put in place, even in a city setting.
For sure. Scott, I'd like to ask you, as someone whose job is to have, regular meetings with legislators and to to really look at some of these policy solutions. If you had that magic wand or 10 minutes on the state house floor, what are some of the things that you're really pushing for that would help healthcare businesses, in the here and now, and in moving into the future, setting them up for success?
Yeah, I think the big thing for our members and to be able to greater expand access to care in Virginia, we have to be willing to be able to reimburse for services, to make sure that people aren't financially crippled by a health episode, and that we can pay physicians to be able to provide what is highly skilled care that is necessary. We need to be building an infrastructure to be able to address another public health emergency, and we need to be able to accelerate the adoption of things like telemedicine, whether it be audiovisual or audio only. I think, like I mentioned before, this pandemic has really highlighted areas where we, in terms of a healthcare system, not just in Virginia, but as a country, we're maybe woefully behind and where we had some gaps. And I don't think we can afford to let off the accelerator in terms of pushing that progress forward, and adopting, some of these, different technologies in order, or systems of care, decoupling, as Dr. Rausch mentioned, and innovative ways to be able to provide care to more patients and make sure that, obviously physicians are able to be supported to be able to provide that care, not just financially, but also, again, thinking about their mental health, and thinking about the strain that such a profession, can cause. And so that's definitely something that we talk about when we are in meetings with legislators representing our members, because, again, like I said, we want them treating patients, and we're happy to talk to the senators and delegates on their behalf.
Great, thank you for that.
Yeah.
I recognize that we were getting close to the noon hour. I always like to wrap these conversations up on sort of a positive note when possible. And one thing that I think about is, in 5-10 years, we'll all be sort of sharing our stories of where were you during the pandemic? How did you handle that? And I'm curious to question for each of you. Is there something positive that stands out to you, an experience you've had, whether it's, just people coming together and stepping up, for the greater good, or just, when you think about your story of the pandemic, is there something that comes to mind as far as an experience goes? Dr. Rausch, do you mind starting us off?
Yeah, kind of. It's a great question. I had one in mind, and I think we already talked about University of Richmond. But for me, just how I think healthcare is changed, hopefully for the better. I think something like this is going to open up some eyes, not necessarily, in the government and individuals, all the way down to the individual, where, health is fragile. We run around all day long and we think about, the next thing that we're doing, and we're rushing and so forth. I think for me right now, what I'm seeing is that the world has slowed down a little bit. And so, just to go into a healthcare, or to go into a gym to go swimming, right? So you want to get your laps in, you've got to make an appointment. When you walk in, you've got to get tested. Like everything slows down. And so I'm enjoying that a little bit more, that maybe we can all just kind of stop, and instead of rushing with our blinders on, we can all kind of stop and take a breath and move through the world a little bit more slowly and kind of take it in a little bit better and kind of recognize how fragile it is. I think that's really what I'm hoping to get out of this. And then from that is, and again, I think Scott thought it's just telemedicine. Like, we have got to use technology to move forward. And this really is huge. And I think this is where it's going to be a big win for, healthcare in general. Just really, we forced technology down the throats of the government and the payers to accept it. so that we really can close gaps in care and get care to people that don't have it. And I think that's, for me, huge. And I'm really happy that at least we're seeing that come out of this.
Absolutely. Great call to action there. I mean, the frenetic pace of our lives can really leave us exhausted at the end of the day. And it's sad to say, maybe it took a pandemic for us to slow down and be mindful of the present moment. But if that is a byproduct of this, then I will celebrate that for sure. Scott, I'd like to give you the last word as you think about sort of your pandemic story, a positive experience or takeaway.
Yeah, I think mine is twofold. The one is the kind of the level of sacrifice that we see from our members to be able to provide care. Obviously, as a society, we hold doctors and nurses and nurse practitioners and physicians assistants and medical professionals in high regard. But to see them on the front lines of this pandemic, the sacrifices they're making to be able to treat these patients and to provide this care at the cost of their own health, at the cost of their mental health, at the cost of sometimes their family's health. I know a surgeon who gave birth weeks before the pandemic started and was on maternity leave kind of during that March timeframe when the pandemic really kicked into high gear. And her husband was also a treating physician and was treating COVID patients and had to live in their garage and could not interact with her, could not provide that kind of that parenting support for a newborn child. But it's a sacrifice that they made, as hard as it was, so that he could keep seeing patients and keep treating this disease. And so I think about her and him a lot. And I think the second part is in combination with the pandemic and kind of the racial strife that we saw this summer. There are conversations happening in the health community about racial inequity, about social determinants of health that frankly haven't happened enough before, that I'm seeing actively happen now. And that's doctors from across generations, across racial lines, having these really hard but necessary conversations about inequities, systemic racism, and things that in a holistic manner affect health and affect healthcare. And so being able to see those conversations happen and be on the sideline for those has been really fulfilling.
Well, gentlemen, thank you. And thank you for that, Scott. I really appreciate both you bringing your insights and perspective to this conversation. And it really has been illuminating for me, understanding everything that's going into running a business during this pandemic, and really thinking about all the logistical levers that have to be pulled to do it safely and practically. So thank you for that. Dr. Rausch, thank you for taking the time today. I appreciate that. And it's been great talking with you.
Yeah, absolutely. No, thanks for having me. It was a great conversation. Great hearing, Scott's side of it as well.
For sure. And Scott, thank you. I appreciate the perspective that you brought to the table today. And I know that Dominion Payroll really values our partnership with the Medical Society of Virginia. So thank you for the work that you're doing out there.
Absolutely. And it was great to have this conversation with Dr. Rausch as well.
Wonderful. Well, gentlemen, I hope that you have a great afternoon. And again, thank you for being here. To everybody out there in webinar land, out there in the ether, we appreciate you joining us today. Before we wrap up, just a quick plug for our year-end seminar. Every year we do this. Generally, we are excited to welcome you into our home in our headquarters in Scotts Addition in Richmond, Virginia. This year we are going all virtual, but the quality of the programming will be top-notch as always. So we do hope that you will join us on November 19th from 9 a.m. to noon. have lots of programming to help you navigate the year end and set you up for success going into 2021. We're handling content like benefits, bonus payrolls, the tax implications of wrapping up the year. We're also going to do a little year in review. It's been a year like none other. And so we'll give you some high level insights on navigating the CARES Act and emergency family medical leave, all sorts of great topics to help you, as we say, finish strong. Please join us here every day for our webinar. You can see our future schedule and register for all of our upcoming webinars at dominionpayroll.com. Just hit that COVID-19 button at the top of the homepage. See the schedule, get registered. There's also a whole host of resources for you to use to help you run your business and serve your employees. Appreciate you being here. I am your host, Kevin Wilson, and this has been an installation of The Beacon. Hope everyone has a great day. And as always, please don't forget to wash your hands.